Mr. Martinez, it sounds like Mr. Freeman has a living will and some other advance directives. I wonder if you could tell me a little bit about those and what his wishes are.
Yes, he wrote a living will and a durable power of attorney designating me as his primary decision maker. We've talked about this a lot. Jerry would not want feeding tubes or IVs or a breathing machine just to keep him alive.
Okay, that's really good to know. Can you tell me, did you talk about scenarios, things that might come up if he were ever hospitalized? Sometimes people think of those breathing tubes and the feeding tubes and things like that, but they don't think about how a physician may come in and say he has a new infection and we may be offering antibiotics. And also there's CPR. And so those are things, I wonder if you've ever talked about them. And if not, how do you know, I feel like you know how he would want the end of his life to be.
Jerry's had a wonderful life. But he's always made it perfectly clear that if he can't participate in our life together, if there's serious illness or total dependency, no quality of life, no joy, he would not want to take measures to prolong his suffering. No water or feeding through a tube, no breathing with the help of a machine, no therapies or surgeries, unless they could improve his quality of life. I know he would want his symptoms controlled, and I know he would want me to have help with his home care.
Okay, wow. It sounds like you have really taken good care of each other by talking about this so clearly. He's really given you a gift by lifting the burden of some of these difficult decisions off of your shoulders. He's actually been able to tell you, it sounds like, exactly what he wants. And so you're not going to have so much confusion when we come to you and say, this is what's going on with him and these are your choices. And we will try to help you with those decisions, but it sounds like you know and you're going to honor what he wants.
I've never thought about it in that way as a gift. But I can see that. And maybe it'll help with the difficulties of explaining my decisions to Brian and Christine, his children.
Yes, and we as a palliative care team would be happy to have some conversations with you and with Brian and Christine as things come up with Mr. Freeman. And you can say to them, he made these decisions a long time ago. We talked about this. This is exactly what he wants, and you can feel confident about that. And you can say, I'm just simply honoring what he wants. I'm not making this decision. I'm just verbalizing, I'm speaking for him. And that I do see as a gift that he's given you.
I would like that.
Be glad to help you with that.
Thank you.
Jerry, I came to give you your 3 o'clock payments. I can tell you're uncomfortable. I'm Barbara. I'm Mr. Freeman. He told me to call him Jerry. He and Alex said go by first name, so I'm his nurse today.
Well, nice to meet you. I'm Christine.
Oh, Christine.
I'm his daughter.
Yes.
This is my brother, Brian.
Hi, Brian.
How are you?
It's so nice that you came to visit your dad. I know he enjoys that. I'm going to go ahead and give you your payments so that you can get a little more comfortable.
Excuse
for
me,
your visitors here.
before he well, my brother and I were just talking. We thought maybe he's over-medicated. I mean, he's so sleepy all the time. He's moaning and groaning. And, you know, the last time that we talked to him, he was very alert. He was talkative. And I see a really big change in him.
When was the last time you saw him?
Oh,
I'm thinking maybe at least 6 months ago.
6 months.
Oh, no,
Yes.
it wasn't that long ago, Brian, please. I think it was around Christmas time we were here, and he was very talkative.
Well, Christmas was about 9 months ago, and from what Alex has told us, Jerry has really gone downhill. He's kind of been spiraling downhill with his dementia progressing. And also he had this unrelieved pain that was only recently diagnosed with the bone metastasis. And that is extremely painful. So, you know, all those things, pain, unrelieved pain can cause more confusion, more, you know, discomfort. Of course, he's sleepy. He's not sleeping well.
Well, I still think he's over-medicated. I mean, does he really have to take that much medication? I mean, Alex would probably like it if he's over-medicated because he's going to be the one who's going to benefit from when my father is gone.
Well, Alex seems very caring when he's here with Jerry. They seem to have a really good relationship. And his goal is to get this pain under control so that Jerry can go back home.
All of you.
Yes, because he deserves good quality of life, and they want to be together at home. But I understand your concern that he may seem sleepy to you or drowsy to you. Part of that is just he's not getting any good sleep. You know, he has unrelieved pain, so he tries to sleep. People with pain still sleep some, but it's not good sleep because the pain interrupts it and makes it.
So, and that's why he's so sleepy, but he's not sleepy and he's not over-medicated.
Well, I look for other signs in a patient that has some dementia as far as what their pain level is, because he can't rate it on a scale like many of our other patients can right now. So I just look for, you know, facial expression, his grimacing, the fact that he rubs his bones like they hurt. Whenever we try to turn or reposition him, he seems terribly uncomfortable. And really his morphine dose isn't that high right now. We're trying to give it around the clock so we can see how much he needs every day, because once we know his daily dose, we can switch him to a long-acting medication, and he'll only have to take a little pill every 12 hours or so, and that'll work really well at home if he has consistent pain relief, and he'll sleep better.
Well, the morphine was in a pill form that you just gave him? Well, I never heard of such.
Oh,
I
yeah,
just
they have wonderful
Oh.
ways, different routes to give the medicine, but with the time release, the pill's very small and very easy to swallow. And like I said, you only have to take it twice a day. So that should help him a lot.
So then how long is he going to be out now? I mean, if we can't talk to him, I don't even know what else can we do while we're here?
Well, you can help me. You can observe
Excuse me?
him. You can help me. Well, I need to go take care of my other patients, but you can watch and see how he responds to the medicine I just gave him. Does his grimacing slow down? Does he seem more comfortable? He may be more alert if he has the pain controlled, and he may be even able to talk with you some.
Well, how long is that going to take?
It usually takes about 30 minutes for the pain medicine.
Oh, well, I'm sorry, but I don't have time for that today. I have to get home. The kids are going to be home soon. I have to make sure they get their homework done, or nobody's going to, you know, they're going to, well, and anyway, I can't stay. Maybe some other time.
Oh, that's,
I can stay.
Oh, that's
I'd like to
good.
spend some
That's good.
time with
Oh,
Dad.
fine.
It's
Well,
been
okay,
a
you do
while.
that, and I'll talk to you later. Thank you.
okay. And you know, with somebody that's got some dementia, we just don't know what they connect to. You know, he may hear you, he may understand you, he may even talk with you some as he connects with what you're saying. But the important thing is the calming voice, and you might talk to him about some memories growing up that he could connect to. And just having visitors is such a good distraction from the pain. So just observe him, see how he does over the next half hour or so, and I'll come back in and check on you after I give my other medications.
Okay,
So-
that'd be fine. I'd like to spend a little time with Dad.
Okay, and if you do need me, push the call light. I'll be
Okay.
out here working on the floor. I'll see you
do
later,
that.
Jerry, okay? Okay.
Hey, Dad. It's Brian.
Brian, it was nice seeing you today, and I just wanted to make sure that you knew how to get a hold of me if you had any other
Dr.
questions.
Earnshaw, I'm so glad you're still here.
Hi, Christine. It's nice to see you
Nice
today.
to see
How
you
are
too. Well, I'm a little worried about
Okay.
Dad. Some of his meds I've been a little concerned about.
Okay. Can you tell me more about your concerns?
Well, he's very confused. He's very sleepy. I'm wondering if he's not being over-medicated. Now, yesterday we saw the nurse. We talked to her a little bit. She was adamant that he was going to get his medication every 3 hours, and she would make sure he gets his pills every 3 hours, whether he needed them or not. Now, don't you agree that's going just a little bit too far?
Okay. Well, maybe we could back up just for a minute. I do want to understand what you mean by him getting better.
Well, for starters, I would like to be able to have a conversation with him, as does Brian, and like to see him not so sleepy, and, well, probably sitting up a little bit, maybe walking, eating on a regular basis, getting the right amount of sleep so that he's not groggy all the time, and, you know, we're just a little concerned about that.
Okay. Was there something specific that you were concerned about with his pain medications?
Well, the narcotics, we looked online about that. We double-checked online about all of those things. And we were concerned about narcotics being given to the elderly and maybe being over-medicated. And Dad is 79. Not good. We're very concerned about that.
Okay. And you know, I think that it's not uncommon to go online and see, you know, all the side effects listed on the internet, and it can be really anxiety provoking. And I do think that we need to sit down and talk about all the medications he's on, and you know, we'll talk about that in a minute. But I do wonder if you know why he's getting the pain medication.
Well, I would assume to get better.
Yeah.
You know,
Absolutely.
and you know, speaking of something else, I don't know if he needs to take the heart medicine as well, the blood thinner. Aren't we just like overdoing it a little bit too much? I mean, I know you are very good at what you do, but I'm just a little concerned about all of these medications.
Sure, absolutely. Well, and I do think that pain medications are essential, and I don't know if you're aware of the extent of his cancer, but his prostate cancer has spread to his bones. And so when he came into the hospital when I first met him, he was moaning and screaming at times, writhing in pain, grabbing his hip. He was so uncomfortable. And so we felt that pain medications were obviously necessary. And you know, he hadn't slept in days because he had been in so much pain. So commonly what we see once we get the pain under control is that patients are able to rest. And so I would expect him to sleep for the next couple of days. And you're right. I mean, pain medications can make patients sleepy, but that's usually a side effect that wears off within 24 to 48 hours once the patient gets used to the medication. And so, you know, we're really, you know, our intention is really to make sure that his pain's controlled. We're not trying to make him sleepy with the medicines.
I understand. I will say though, we found something out last night. Brian talked to his family physician. Told him about Dad's situation, and that doctor said that palliative care is known for over-medicating the elderly, and I'm just like maybe even hastening their death. Now that was very scary to hear.
Oh, I'm sure.
Yeah, I mean,
sure
that's what he did express to us.
Okay, no, I'm sure that would be very scary to hear. And I'll tell you, this is not the first time I've heard it before. This is a really common misunderstanding about palliative care and what we do. And I just want you to know that we do have evidence, and we do have research that has looked at patients in your dad's condition who have advanced cancer, who are in the hospital, who are having pain. And when you look at patients at this stage of life and compare them to patients who don't get pain medications, there's no difference in life expectancy between the two groups. So we do have evidence that these medications do not hasten death. And you know, when I talked to Alex, he said that your dad had told him that treating pain was a #1 priority. And so what we're really trying to do is honor your dad's wishes.
Well, I understand that. I just, I just wish he would get better.
Yeah. No, I know, and I think that what would be really helpful in this situation is that we would all sit down and together, and that we could all really talk about your dad's condition and make some plans for going forward.
Well, that's what we
address some of your
want. We would love to
concerns.
have somebody hear us and listen to us.
Yeah, well, no, I want you to know I hear your concerns and I take them very seriously. And we were already planning on, possibly touching base this afternoon to discuss what had happened since that your dad had been here. So I was hoping that we could all sit down together.
Well, this is the first mention I've heard of it. I have a hair appointment this afternoon, and once you cancel, it's really hard to get back on the books. Sure. I don't know, maybe it's...
Sis, I mean, this sounds important. We really...
I know it does. 2 o'clock?
Yeah, that's
around 2 o'clock.
I
I
think
could be
it's-
there. I'll be there.
Well, thank you, because I think it's really important you're
Thank
here.
you.
And I'll look forward to talking to you more about these things.
Thank you. I really appreciate it. Thank you for both of us.
You're welcome.
Yes, thank you, Doctor.
Mr. Freeman, my name is Frank Vogon and I'm one of the chaplains on the team here. I know you haven't met me and I don't think we have met. Are you family?
Alex.
Oh, you're his partner?
Yes.
Okay, nice to meet you. We haven't met yet, but his nurse called and she was concerned because he was upset earlier, and that's why I came by.
Jerry, don't get all worked up again. Let me take care of this, okay? I'm not sure we need you. You see, Jerry is not a believer, and all of this sudden God stuff is really upsetting to him.
Well, thanks for letting me know. I'm certainly not here to push or to talk any God stuff. As a team, we are concerned that he and that you get the best care, and that includes any emotional support that we can offer, or even support with the existential issues that come up with a serious diagnosis like his.
Well, it's certainly brought up a lot, and I don't even know where to start in order to deal with it.
You have a lot on your plate. Now, what happened earlier that upset him so?
Oh, God. As if we needed more chaos. His children came by this morning to tell him that they had been talking to a priest to have him anointed. I'm sure they mean well, but they also know that Jerry hasn't stepped foot inside a church in decades, and also that he never was interested in all that pious mumbo-jumbo, and that's what upset him.
Okay.
I probably should have just told them to cancel the visit, but I didn't want to upset them. You know, we still have to work some things out with them. And they left anyway. But I just don't want some priest wandering in here while he's so confused and doing something to him.
And that's understandable, and that should not happen if he doesn't wish for a priest to come by. Now, what we can do is we can alert the staff and let the nurses at the desk know that he does not wish to have a priest visit.
Alex.
I'm here, hon. I'm just talking to the chaplain. He might help us talk to Christine and Brian.
Do you mind if I talk to him for a moment?
I don't think he'll know who you are, but yeah, if you want to.
Mr. Freeman, I introduced myself earlier. My name is Frank Vogon and I'm one of the chaplains. Here I heard what happened earlier, and I just want you to know that if you don't want a priest to visit you, that we want to make sure that your wishes are honored and that your decisions are honored.
Can you get Alex?
Yeah, he's right here. See? Now, as I said, I want to support you in any way that I can, and if you think it would be helpful for me as a team member to talk to Jerry's children and help them understand where he's coming from, I'll be glad to do that. I also can join you and support you if you want to meet with them and talk. Or if you don't want me involved in this, that's your decision, and that's fine too.
I don't know. Maybe we could do it together.
Okay.
Yeah, I think that would be best. I think they'll be back in the afternoon.
All right. I'm here all day, so if you know the time, you can let the staff know and they can page me. They have my number. What would help me would be if we could maybe meet and talk for a few minutes before we talk to his children, and you could let me know a little bit about Jerry's journey and what's important to him.
There are many things that are important to Jerry.
Yeah.
And I'll be glad to tell you.
Okay.